Search and rescue workers in South Florida are bracing for the first Atlantic hurricane of the season and its potential impact on their rescue efforts at the Surfside condo collapse. It comes a day after search operations resumed following safety concerns. 20 people so far have been confirmed dead in the collapse, including the 7-year-old daughter of a Miami firefighter. 128 people are unaccounted for. CBS News correspondent Omar Villafranca reports.
We will continue to search feverishly, as we have done all along, in the parts of the collapse that we currently have access to.
Search and rescue efforts resumed Thursday afternoon after a 15-hour standstill over safety concerns that the rest of the building could come down. Officials in Miami-Dade County said they are planning for a likely demolition of the remaining building.
This is a decision that we need to make extremely carefully and methodically.
Alan Kilsheimer is a structural engineer.
No one really knows in detail exactly what the condition of the remaining building is. We also have a storm coming, so we're looking at the storm and what it does to the building.
Could this storm knock the remaining parts of the building down?
Everything's possible.
Earlier Thursday, President Biden and the First Lady paid their respects at a growing memorial after meeting with first responders.
The whole nation is mourning with these families. They see it every day on television. They're going through hell.
Moments earlier, Mr. Biden privately met with survivors and victims' families for nearly 3 hours.
The president came out and he spoke a few things. It was like, I'm here for you. Hang in there.
Including Steve Rosenthal, who had lived in the condo for 20 years before it collapsed.
But we lost everything. When he was finished, he literally went to every table, talked to every person, and as long as you were talking, he was listening. It was amazing.
FEMA says it'll likely be weeks before the rest of the building here behind me is brought down. President Biden has ordered a probe into what caused the collapse, and he also pledged that the federal government will pay for the first month of the response. Omar Villafranca, CBS News, Surfside, Florida.
Joining me to talk about the health concerns surrounding this building is Dr. Shirin Shafazand. She is a pulmonologist and professor at the University of Miami. Doctor, welcome. Thank you so much for joining us. Can you explain the immediate health risks search crews and victims face in the aftermath of a building collapse?
Thank you for inviting me. Unfortunately, immediately where there is concerns about remainder of the building collapsing and stability in the area, there is the immediate risk to the first responders with respect to injuries for them. And then with the dust that's generated from the collapse of the building, there's a variety of material in the air, organic, inorganic, that could potentially be toxic to anyone who's breathing that air. And definitely in the immediate few hours can lead to problems with congestion in the nose, coughing, feeling short of breath, chest tightness if proper protective equipment is not available.
And so we can assume, since this building is not that old, 40 years, I believe, more or less, that there's not asbestos in the building. Is that correct?
Potentially, yes. There are other materials. Go ahead.
No, I was going to ask, what are some of the other potentially toxic materials that might be present?
So the dust particles that are generated, there's silica, could be inhaled in the lungs and settle in the nose area and in the lungs and eventually cause long-term damage to the lungs, scarring and fibrosis. But just the general amount of air particles that exist can also worsen the breathing for people who have underlying lung conditions and heart conditions like asthma, or if they have heart failure. And in general, it's just not a healthy air quality environment. We don't exactly know what the air quality is like currently at the site, although there are studies being done by my colleagues at University of Miami. Dr. Caban Martinez and his team are doing studies to see individually the amount of exposure that the first responders are having to pollutants in the air and just the overall air quality.
And so typically at a construction site, water is used to keep the dust down. I guess there's been some rain, so potentially the weather is helping with that in this situation. But what other problems could the addition of water create?
Well, I think one of the concerns that you're also reporting on is the extra rain, and now with the hurricane coming, potentially the wind and rain combined, can create some dangerous environments for the people who are attempting rescue. So it may, in all likelihood, halt rescue efforts, at least in certain parts, and create for dangerous environment for the first responders. So that's a big concern right now with the wind and wind and water that we might be facing with the storm.
And so short and long term, what major health problems could both victims and search crews be facing because of this collapse?
The victims, with respect to the immediate impact, of course, is the potential for crush injuries as the weight of the collapsed building, and they're buried under that weight. There's, of course, potential for burn injuries and chemical injuries, depending on what is happening at the site. And depending on how long they're trapped, they will have issues with respect to access to water and eventually access to food. For the first responders, the immediate impact would be the quality of the air that they're breathing, and that's why these protective masks that they're wearing is crucial. But also over long term, I think it's important to remind ourselves that not only is this difficult for the families who have lost loved ones or who are waiting for news, but it's also very difficult from the mental health perspective for the first responders as they are working for days and days with minimal success in finding survivors, and it does take its toll. They have 12-hour shifts and they're supposed to rest the other 12 hours. However, with the emotional toll that this takes, it becomes very difficult to sleep, adds to the stress level. So there's a variety of psychological and physical impacts. And our experience with unfortunate tragedies like this, and the biggest scale would have been the World Trade Center, shows that there are potential long-term health impacts as well with respect to the lungs, scarring in the lungs, and increased likelihood of various cancers. But that also depends on the amount of exposure, the scale of the exposure. So we will have to wait and see and follow up on all these issues.
Dr. Shirin Shafazand in Miami, thank you so much for joining us.
Thank you. It was my pleasure.